Good morning. My topic for this morning is all about Philippine Nutrition Program implementation amidst COVID-19 pandemic. In Republic Act number 11148, Section 2, the right to health is a fundamental principle guaranteed by the state. Section 15, Article 11 of the 1987 Constitution emphasizes that the state shall protect and promote the right to health of the people and instill health consciousness among them. Moreover, pursuant to various international human rights instruments and agreements that the state adheres to, the state guarantees the right to adequate food, care, and nutrition to pregnant and lactating mothers, including adolescent girls, women of reproductive age, and especially children from 0 to 2 years old. Now, what are those programs implemented by the Philippine Nutrition amidst COVID-19 pandemic? First, we have here the health security. Now, what is health security? Health security, this includes the recognition of children and families in need of urgent assistance. Health protection is a term that includes practices and interventions that mitigate public health incidents across territorial borders to ensure the health of populations in relations to security studies. This is an emerging paradigm. Example, intentional health protection policies are part of access to health services, access to preventive medication, vaccine programs, and disease prevention. Next is the nutritional assistance. Nutritional assistants have the following: child nutrition program, food distribution programs, nutrition programs for seniors, supplemental nutrition assistance program, women, infants, and children hunger and food security resources, FNS nutrition programs. Child nutrition program services helps ensure that children in classrooms, summer programs, child centers and families, and other school programs have access to nutritional meals and snacks. Find kids' meals when schools are closed. Food distribution programs, complex combinations of activities, functions, and relationships, handling, storage, transport, processing, packaging, wholesale, retail, and etc. are the food supply and distribution system for cities that allows cities to meet their food requirements. Food distribution programs and the nutrition programs for seniors is not the same. It's because the nutrition programs for seniors to direct national policy, the Congress commissioned the 1992 research review of the Elderly Nutrition Program, or ENP, the nation's oldest system for offering community-based and home-based preventive nutrition and health-related services to older citizens. Supplemental Nutrition Assistance Program, or SNAP, provides nutritional benefits to supplement the food budget of needy families so that they can purchase healthy food and have towards self-sufficiency. The WIC Women, Infants, and Children's Hunger and Food Security Resources, or FNS nutrition programs, grants federal to state for supplementary food, healthcare, referrals, and nutrition educations for low income, host partners, or the breastfeeding and non-breastfeeding women, and to infants and children up to age of 5 to are at nutritional rest. So those are all belongs to nutritional assistance. Then we have here the food processing. In food processing, there are many ways in a quick process. The processing of food is the conversion of agriculture products into food or into other types of one type of food. Food processing involves many types of food processing, from grinding grain to making raw flour to cooking at home to sophisticated manufacturing process used to make foods that are convenient. So we have here the capacity and the resources, the cost, the multi-path maps, the lead time, and the demand. So those are all the quick processing. Nutritional education. Nutritional education is the method of teaching a person or a community the science of nutrition in the clinic, neighborhood, or long-term healthcare facility. Health professionals have a different role in educating a person. The dietitian, nutritionist, or nurse serves to support or allow individuals to integrate improvements in eating habits and behavioral into their lives. In these settings, awareness and evidence are not the main focus of this form of diet, but rather the creation of permanent behavioral improvements. We have here the family planning. So, what is family planning? Family planning services are defined as educational, comprehensive medical, or social activities which enable individuals, including minors, to determine freely the number and the spacing of their children and to select the means by which this may be achieved. Family planning may involve consideration of the number, a program to regulate the number and spacing of children by the practice of contraceptives or other birth control strategies in a family. Then, before I will proceed to the next for my lesson, so I will show you a small video about COVID-19.
So the whole family of coronaviruses are named coronavirus because corona means crown. And so this refers to the way that the virus looks under the microscope, like there's a crown on the top of the virus. Some of them, 4 or 5 different kinds, cause common diseases among humans. Everything from the common cold to mild or moderate respiratory illnesses. Other kinds of coronaviruses affect animals. And sometimes, on rare occasions, we see coronaviruses jump from animal species into the human population. The 2019 novel coronavirus is getting a lot of attention now because it is a new kind of coronavirus we haven't seen among humans before. The theory is that it may have jumped from an animal species into the human population and then begun spreading. We have seen some people that have died of this disease, and we know that there are already thousands of cases. So people are concerned because we don't yet know exactly how severe the disease will be or how far it will spread. When a new virus emerges, we often have to learn much more about it. And one of the things that we question is, how does it transmit from person to person? We know that most respiratory viruses are spread by large droplets that come out when people cough and sneeze and stay aloft usually for about 6 feet in front of them. They land on surfaces and then can also be transmitted between person to person by touching those surfaces, such as doorknobs or other surfaces. Other viruses can spread in the air and stay aloft for a longer period of time in small droplet nuclei. For this current 2019 coronavirus, we're not yet sure whether it is droplet or airborne transmission. So we're erring on the side of caution and taking protection as if it was spread by the airborne route. We're still learning a lot about this 2019 novel coronavirus to understand how dangerous it might be. Right now, the majority of the cases are in China. We know that some travelers have brought the virus to other countries, including the United States. I think one of the main things to keep in mind is that this is respiratory virus season, and we have other respiratory viruses like influenza that we need to take precautions because we know we have thousands of cases and thousands of deaths in this country every year from influenza. Given the ongoing transmission of the virus in China, we have a travel alert that was issued by the Centers for Disease Control and Prevention. So at this time, until we know more, avoid non-essential travel to China. Johns Hopkins Health System and health systems across the nation are busy right now preparing to safely identify, isolate, evaluate, and care for patients with the 2019 novel coronavirus. We have the capability of doing this safely by utilizing personal protective equipment, by implementing travel screening so that we can quickly identify patients who have risk factors for the disease, and then implementing isolation precautions, the use of personal protective equipment, and other measures to make sure that we limit the spread of the virus. At the Johns Hopkins Hospital and throughout our health system, we routinely care for patients infected with diseases that are spread by the airborne route. So we have expertise to do this safely. When a new virus comes along that has unknown risks, we have extra measures that we can put in place, including our biocontainment unit that can advise us and put plans in place to safely care for these patients.
Okay, so that is the video all about it's all about pandemic rather, and the doctor explains the difference between epidemic and pandemic. The story continues below. So practically speaking, what happens when an outbreak goes nationwide in a pandemic? It is important to note that it has little to do with the disease seriousness, but its distribution is more important. A little trickier is the actual declaration of a pandemic. In epidemic regions, people who catch the disease and fly back to their home currently or country to do not count in describing a pandemic. A pandemic is proclaimed only when population's transmission is spreading from one person to another without direct ties to travel and affected areas is widespread around the world. The local government units promotes or the LGU promote good nutrition amidst COVID-19 pandemic. So there are many protocols that we're going to follow, such as wearing of face mask and um, at least 75% of alcohol for sanitize, and many many protocols that we're going to follow, especially in pandemic. So that's all. Thank you for listening.